Today we are honored to welcome Gwen Bernardo to the show today. I'm very happy to have her on. She is a myofascial therapist, and this is a very important topic to talk about today. There's so many different things that go into this, and it can really be an excellent tool for working to get out of pain and everything that can act in synergy can make this a very powerful tool. Very happy to have her on today to share her story, how this can benefit you in your life. So how are you doing today?
Oh, I'm doing great, Anthony. Thank you so much for inviting me to be on your show. I'm really honored to be here. Thanks.
Absolutely. So I'm very curious to hear your story, how you got into myofascial therapy and wellness and how you're helping people today.
So my story starts a little while ago. I actually am trained as an equine physical therapist and was not familiar with myofascial release except the old school of myofascial release back when I had gotten hurt many years ago with foam rollers. People should be familiar with the myofascial release of the foam roller. It's no fun. Anyway, I needed some continuing education and decided to take an equine myofascial release class and was really excited about the results that I was getting with my equine clients, such that after about 3 months of treating the horses and horses shaving, fractions of a second off of their racing time, jumping a little bit higher, moving with more ease, the trainers and the owners started to ask me to work on them because they said, oh my gosh, Copper's back is doing so much better. Can you help me with my back? And I said, well, muscles are muscles. I can try. And I did. And they were starting to feel a lot of relief. So I got very excited by that. But then I realized I should experience myofascial release for myself because I hadn't had any treatment. So I went, and after my first 6 hours of treatment, I was shocked that I was able to actually drop 19 years of PTSD and pain stemming from a serious horseback riding accident almost 20 years ago. So I decided I had to share this with everybody, that this was available. So I went back and I got a license to touch, is what we call it in California, and I became a massage therapist, and now I'm a full-time myofascial release therapist.
Oh, that's an excellent story. So it sounds like you got into it through your own injuries as well, and it kind of really was beneficial for you. So that's amazing.
Yeah, like I said, I was really shocked at how it was life-changing for me. It literally changed my life. It changed my career. It changed my outlook. It has been phenomenal and very unexpected.
Yeah, I find like we always get into this space of wellness through our own stories of healing or that someone that we love. So it's always interesting to hear stories so we can actually kind of relate to it in a sense, right? So we can kind of get into it and see how it benefits us. So thank you for sharing. Can you explain to people what exactly is myofascial release?
Yeah, so fascia is the connective tissue that connects us from the top of our heads to the bottom of our toes. And, back in grade school, we all learned about the muscular system and the cardiovascular system and the nervous system. But we never learned about the fascial system, which is a serious bummer because that's about where 90% of our pain is actually stored. It's this connective tissue, which is actually one thread. It's sort of like a sweater that has been knit out of one thread. If you've ever been wearing your sweater and you get it snagged someplace, you'll feel it tug someplace else. Maybe you feel it tug at the neck or the shoulder or the bottom, even though the snag might be 6 or 8 inches away. It's because it's all interconnected. Our fascia is exactly the same way.
Very interesting. So it's kind of like this thing that kind of runs throughout our entire body and is kind of interconnected with everything. Is that right?
Yes, actually, there's aspects of fascia in literally every cell in your body, your organs, your muscles, your nerves, your tendons. You have fascia in your nose, and your eyes have fascia. Everywhere has fascia. So it's pretty incredible. Fascia is you, and you are your fascia.
Very fascinating, yeah. So in terms of the release aspect, what exactly does that entail and how can that be beneficial?
So we get restrictions in our body due to physical trauma, emotional trauma, any sort. And when I say trauma, it doesn't have to be something as massive as a car accident. Your body considers stepping off a curb funny and kind of jacking your ankle a trauma. It's an insult to your fascial system. And what happens is this fascia is fluid, but it gets a restriction and it gets sticky. I apologize, I lost my train of thought.
No worries. Yeah, so the fascia is definitely kind of gets these adhesions in it, right? And it's very like, it can kind of gum up the system.
That's exactly it. Adhesions happen through trauma, and it can impact anywhere else in the body because we don't know where these restrictions lead. So again, like that sweater analogy, depending on where you get it caught depends on where it pulls. So that is why you can be perpetually treating the shoulder, treating the shoulder, treating the shoulder, but the pain is actually coming from the hip. And unless we come to the root cause of the shoulder pain, you'll never be able to release it fully because the pain is actually stemming from a restriction in the hip.
Yeah, it's very interesting, right? Because we have these pains in our bodies, and it may be completely in an unrelated space, like upstream or downstream. We don't really understand that.
Correct. And fascial restrictions are also individualized and personal. So I may have 3 clients that come in with back pain, and one is actually coming from the back, but one might be coming from the neck, and one might be coming from, believe it or not, a pinky toe that got caught in a door. But due to time, the restriction upon restriction in the system that is supposed to be fluid eventually makes its way up to the back. And until we figure out that it could be coming from the pinky toe, we're never going to be free of that back pain. And that's what's so exciting about myofascial release is we begin to release these restrictions that as therapists we find when we work with our clients.
Yeah, it's fascinating. It's like being able to get to the root of the issue. I mean, I bet it can solve a lot of problems because we've probably done so many different therapies for these pains and we don't really understand why it's not working, right? So it's being able to get to the root cause is so important.
Exactly. And so we have something that is called the fascial voice, and it's your body as we're working together that lets us know where the restrictions are. We're trained to treat the symptom, so we're going to treat the back pain, but we're going to look elsewhere for the cause. And your body is going to either come up with somewhere that is hot, hard, tender, might turn red as we're working in an area that's completely different from where we're working. And that's your fascial system saying, hey, there's restrictions here. Let's release these. Let's put more space in the system. What happens is the system gets stuck, and so you are not as efficient at hydrating yourself, bringing yourself nutrition, because there is a stickiness to this system that's supposed to be fluid and flowing.
Absolutely. So what are some common causes for these muscle adhesions to our bodies? Like, is it our day-to-day lives? Like, what do you see commonly?
So mostly I see folks with back pain or hip pain. And believe it or not, most grown-ups have a leg that is functionally, not structurally, but functionally longer than the other, which means that most of us have a pelvis. Our pelvis is tilted forward, usually on the right side. I think it's because we're right-handed and we drive with our right foot. That's just there's no scientific proof. But that repetitive motion over years and years of driving can tilt your pelvis forward ever so slightly, which makes that leg ever so slightly longer. And think about how many steps you're taking. And even if it's a micro, a millimeter off, eventually that's going to cause problems. So something as simple as that can cause the body to begin to make adhesions.
It's sort of fascinating. It's just something to think about because these daily habits we have throughout our day, whether it's these things we do that we don't really think about, but it's really causing all these structure differences in our bodies, right? Whether it's the driving that you mentioned and just being aware of these habits throughout our day, it can really make a difference, right? And it's not like not to do these things, it's like kind of to adjust it in a sense. That's what I find.
Yeah, exactly. And that's why getting treated, one of the first things we'll do is, as therapists, is we'll balance the pelvis. Notice I didn't say adjust. We balance the pelvis because we want your body to be in alignment for you. So myofascial release doesn't have an agenda. We don't have a protocol. We treat what we see and what we find. So it's personalized healthcare.
Yeah, that's what it's all about. Just that's the exciting part about it too, because we can kind of personalize that you mentioned, but we have these specific issues that so many different strategies that I would like to get into. So when you see people with different types of pains, like what are the results that you see? Like how does this work with other therapies as well?
So this therapy works great as a standalone, but it also complements things like acupuncture, chiropractic, and physical therapy. This work is about sinking into the tissues and using a time and a pressure element. And what that allows the body to do is to soften, and it allows the fascial system to open. And not to get too technical, but our cells basically are made of three components: collagen, elastin, and a ground substance. And what can happen with trauma and injury is the cell starts to change shape and it gets squished. This is very unscientific, but imagine it gets squished. Given the correct amount of time and pressure through myofascial release, the cell begins to change shape again and open up. And it allows more fluidity of the ground substance. So this can work with PT. I like to say PT is there to strengthen and we're here to lengthen. And it can work with chiropractic because we're going to lengthen and put space in the system that allows for an adjustment to last longer. So it's very complementary to other modalities.
Yeah, it makes sense. It's like being able to hydrate ourselves in a sense, because we kind of talk about muscle adhesions, but it's like these things are kind of making our cells clump together in a sense. It's hard to get hydrated and hard to move properly as well.
Correct. And so once you begin to release these restrictions, you'll find that muscle knots begin to quote unquote melt. It's because your body is able to come in and heal that deep adhesion. And I'd love to say it's a magic wand and you come in once and everything is fixed. That's not the case. Your body didn't get that way overnight, so it does take a number of sessions. But the real nice thing is with myofascial release, once you release the root, it's actually released. Once you get to that and there's space and hydration in the system, that injury and trauma is done once that adhesion is released. So I love that too.
I would imagine it really helps with mobility as well, just being able to be like moving everything through the proper range of motion. Do you find that?
Yeah, actually, that's my favorite story. As one of my clients came to me after a serious horseback riding accident about 8 years ago, and she lost range of motion in her shoulder, and she tried PT and chiropractic and acupuncture, and she was able to get her shoulder up to about shoulder length, but she was never able to raise her arm above her head. And we worked together, and through a couple of sessions, she was able to lift her arm all the way up and over. And as excited as I was that day, I was like, okay, let's see if this sticks, because sometimes that's the way muscles act. It'll go back to its original holding pattern. Anyway, I'm excited to say almost a year later, she still has the full range of motion in that shoulder, where it was practically frozen for 8 years.
Awesome. Yeah, what is the difference between flexibility and mobility? To my understanding, you can correct me on this, but it's like mobility is kind of like the range of motion, right? But while stretching, it's kind of like, it doesn't necessarily remove the adhesions, which is kind of like responsible for the mobility issues and things like that. It's like these static stretches, they're not as important as, say, like being able to move throughout the full range of motion.
Correct, because static stretching tends to have an agenda where it takes you to the end range of motion and then pushes. And that is not what we do. We go to resistance and then we stop at resistance and allow the body to go further on its own. Right.
Yeah, not there's anything wrong with it, just different tools. And of course you have like the dynamic stretches, which is great for like warm-ups and things like that. But it's always different, and kind of being able to intelligently utilize these tools in a way that is beneficial for our own goals, is that's what matters.
100%.
Yeah. So you mentioned how you find clients that these certain issues that they haven't really dealt with, and how it acts with synergy with all these things, right? And they develop these pains throughout their life, and then they're getting to the root cause of the issue. So, what are some like what does it look like exactly? Like what is being done to release the fascia?
So again, it's time and pressure that's being used. And so most people can picture going to a regular massage, a Swedish massage, where they use oil and lotion and they glide around and it feels really great. This actually is almost the opposite. Not that it doesn't feel good. I call it the velvet wrecking ball because it's actually quite gentle. But we're using time and pressure. So there's no oil, there's no lotion. We sink into the fascial system, which is your skin, or let's say, we'll sink into your thigh, and we will stay in one position for 5, 10, 15 minutes, waiting for that release, waiting for your body to soften, because that's what this work is about. It's about softening.
Got it. So, does it kind of depend on the issue itself, like in terms of the therapies that are being done? Because I would imagine that if someone has some long-lasting issue, it would be different from maybe they're just trying to optimize or just new current injury that they're dealing with.
So that's a great question. Actually, we follow what the body says. Like I said, there's no protocol. My mentor and teacher, John Barnes, who was the founder of this modern-day myofascial release, he always said, if you know what you're doing when you're going in the room, before you get in the room, you don't know what you're doing. So there's never an agenda, there's never a protocol. There are techniques, but you wait and you treat the patient and you see what you have. So it isn't necessarily a different treatment if someone comes in with an acute injury, but I do recommend people see their myofascial release therapist sooner than later, because it's easier to release restrictions that are younger than, say, restrictions that might be 20 or 30 years old. I'll give you a perfect example. Yesterday, I wound up falling off of my horse, and I saw my myofascial release therapist, and we were able to get on top of the inflammation in my arm and also the pain in my sacrum. And without myofascial release, I know enough. I've fallen off my horse plenty of times that I would not be able to get out of bed today, and walking would be horrible. But today I was up and no problem. I actually worked on some clients this morning, so my arm is better. And that's because I was able to get therapy within 4 hours of my fall.
Wow, that's incredible. Yeah, as you mentioned, being able to listen to the body, it's so important because it's going to let us know what we need in that moment. It's very important to learn that skill, right? Because it's a skill, just being able to listen and see what it needs. Because there's so many times we just ignore these signals, and the issue just gets worse and worse as we go.
Yeah, so the body has the language of pain. And so, initially the body will whisper, and then it might tap us, and then it speaks in a soft voice, and finally it has to yell if we haven't given it enough attention. And one of the things that we learn through myofascial release also is to listen to our bodies and to allow what happens. So, perfect example was yesterday after I fell on my arm started to twitch, and it looked almost like it was convulsing. And most people would see that and they would try and stop it because they would be afraid of what was happening. But I knew enough to allow my arm to go through the motions of what it needed to go to release the energy that happened when I struck the ground with my arm. So that's also been something that's been really fascinating, is allowing your body, when you have an injury, to do what it naturally wants to do, which usually is to shake. And because you're shaking off the energy of what just happened to the physical injury that you just received.
Very fascinating. Yeah, just starting to get in touch with these things can really help us kind of heal faster as well. Just being able to see what it needs. It's not always something that is serious, but if we kind of keep going along that path, it may turn serious in a sense. So just kind of relax into the moment. And I find that's really helpful for any type of injury.
Yes, 100%. And also trying to be as present in your body as well. Because sometimes pain, we try to check out and avoid the pain. But pain is literally your body telling you information, and when we listen to it, we are able to process it and move through it more easily.
Definitely. So, is there any tools that people can use themselves to do this, or is there
Sure,
thing
yeah.
yeah.
There are lots of tools available on Amazon. There's cranial cradles that allow you to traction your neck is a great thing you can use. 4-inch balls are great. The key when you use any self-treatment tool to get the effect of myofascial release is to actually allow yourself to soften onto your tool, whether it's a racquetball, a tennis ball, a cranial cradle, a sacral wedgie. The key is to soften, and the key is time. Most practitioners will tell you, sure, lay on XYZ for 30 seconds, 40 seconds, a minute. No. You honestly need to be there for a minimum of 5 minutes. I teach my clients that they should set an alarm for 7 minutes, and they should not be talking to the kids, not be playing with the dog, not doom scrolling on their phones. They need to lay on their ball or their treatment tool and really feel themselves soften and begin to make room in their fascial system, and they need to be present. That's really the way to make the self-care tools work for you.
Awesome. Yeah, I find like mobility is a skill in of itself. Like, I think it's important to stay on top of the practice, right? Just because, like, staying ready, so you have to get ready in a sense. Just being able to be ready for life and be able to move. I
Yes.
feel like it's such an important tool, just like for exercise as well. If you're kind of like already mobile and you're kind of doing these movements throughout the day, you don't have to do a whole lot of warming up.
Correct, 100%. It's so much easier if you're already fluid and moving than to try and stop and start. I think it's
Yeah.
called inertia. A body in motion likes to stay in motion.
That's right. I mean, just being able to stay in motion is because we get injured doing like the craziest things these days, right? And it's these basic movement patterns that we're not used to. I mean, if we're just picking things up, but we're not able to move through our proper range of motion, we just get injured. And it's kind of, we're just, because we're so sedentary these days, you know?
100%. And a lot of my practice, actually, it's called thoracic outlet syndrome, TOS, or you might know it as tech neck. Everybody has their head pitched forward, and the more forward your head goes, the more it begins to weigh on your body, and the more it pulls the ligaments and the muscles in your back, but it's also weakening everything in the front. So everybody needs to be super cognizant of picking your head up, kind of putting it back over your shoulders as opposed to allowing it to tip forward.
That's right. So you mentioned these tools for mobility, and when we start to utilize these things, and is there anything that we should not do for the myofascia? Because I understand like there's most things you can, but maybe there's certain areas that you want to be careful of. Or, am I right on that?
You know what? The first 12 weeks of pregnancy, we don't tend to treat pregnant patients. We don't tend to treat brand new fractures or brand new open wounds. We'll stay away from that. That doesn't mean that we can't treat another area of the body, but no, we stay away from fresh fractures and fresh open wounds. But other than that, pretty much, you know, there are very few contraindications, but when you find a skilled practitioner, they will be able to tell you specifically if your issue is a contraindication.
That makes sense. So again, it goes back to personalization again.
Exactly.
So when it comes to mobility and myofascial release, is there anything outside of like pain or mobility that we should do this for? Like, do you find a connection with the fascia and emotions? That's what I wanted to ask you.
Yes, 100%. And that was actually part of what was so surprising to me after my first 6 hours of treatment was I had been trying to move past my accident. So the first time I got on a horse as an adult, I was run away with, and thrown into a metal fence. I cut my head, I gashed my head, cut it open, concussion, broke 3 ribs, twisted my ankle, had a huge hematoma. And I neglected to say that all I ever wanted was a horse. And my parents were like, if you want to eat 3 meals a day, you're not getting a horse. And so as a grown-up, that's all I wanted was a horse, was a horse, was a horse. Had this horrible accident, and then literally the next day went and bought a horse because I'm a crazy person. Most horse people are. Anyway, my sport is where I jump over things. And I did not realize how much that accident really stifled my ability to move forward in my sport, because I was still terrified. Even though I had moved past that accident, my body was still stuck in fight or flight from that accident. So it took everything in me to jump. I would have to force myself because I had such a passion for it. So, I mean, I did years of talk therapy, years of hypnotherapy to try and move past this, to make my riding more pleasant for myself. You know, but I was still competing and still showing and still jumping, but there was always an aspect of anxiety. So fast forward to getting 6 hours of this work, and because it is a somatic experience, I actually was able to release all of that anxiety. Because the talk therapy took me about 90% of the way there. This allowed me to complete it because what had happened during the accident was I checked out, right? Like you do in a car accident. You have to save yourself. You mentally check out. My body needed to complete what had happened in the accident, and I was never able to do that until I received the myofascial release. And once that happened, my life changed. Like literally, my entire life changed. I didn't tell my trainer that I had had this experience because I came back. I didn't want to tell her things were different. And my very first lesson after the 6 hours of treatment, she said to me, "You're the rider I always knew you could be. What happened? Why are you, I don't understand. You're riding with confidence. You're doing everything that I'm asking you to do without hesitation. What changed?" And then the other thing that was interesting was I got home on a Sunday after the work, and on Thursday, my husband said to me, "You know, that work really changed you. You're bitching at me less." And I was like, "Well, I'm so glad that I bitched at you." And he said, "I never really noticed it, but now that it has stopped, it's noticeable." And I was like, oh my God. And we have a happy marriage. So that's so remarkable that the emotions had a straitjacket on me for so long, and that just 6 hours of treatment allowed me to be free from this straitjacket.
Yeah, it's definitely fascinating. I mean, I just find that it can be very beneficial for just overall stress in your life as well. And
Yes.
just being able to use it as a self-regulation tool.
Yes.
And it's so multifaceted in its approach. Because again, we're working with fascia, which is related to everything.
Yes. 100%. It stores the emotions. It stores, and that was really hard for me to believe. There's actually a book called The Body Keeps the Score. I don't know if you're familiar with that.
Yeah.
Vanderkook. And before myofascial release, I would have poo-pooed it and said, no, that's not true. Emotions don't get stuck in your tissues. Yeah, 100% they absolutely do. And he, documented that trauma changes your DNA. It can. So if it can fundamentally alter a cell, emotions definitely get stuck in the body.
Yeah. There's so many different ways to release it, but this is a very powerful tool. Because, I mean, just kind of like a simple way of looking at it is like you're releasing whatever it is in your body in terms of the muscle stress, but everything is connected. Everything acts in synergy, right? Like the mind-body connection is very real.
100%. And again, before I had received this work, I would have thought that the mind-body connection was incredibly woo-woo and way too out there for me. But after experiencing it for myself, I 100% believe that the body and the mind are the same exact. You can't separate them. They're the same. They're one and the same.
100%, yeah. I do so many different healing modalities, but this is definitely one of my favorites. And it's like just something to be able to do for yourself as a skill as well, and just fit it into your routine. It's like it's so important. It's like being able to stay on top of that just helps you stay more. It helps you like accomplish more in your life. I mean, that's just something that I see.
Yeah, absolutely. It helps you feel better. Even if there's nothing physically going on, it helps you, regulate your emotions. It helps you, I have some clients that they come to see me once a month, not because anything's wrong, but because they're like, oh, I get along better with my sister. Or, oh, I sleep better. There's, no physical pain, but it does improve their life. And I just want to say, I'm obviously not the only myofascial release therapist. I'm located in the San Fernando Valley in California, but anyone, anywhere, there is a directory of myofascial release therapists that are trained by John Barnes that you can reach out and find someone who does exactly what I do, who can help you. So that website is myofascialrelease.com.
Awesome. So when it comes to pain, do you find that these are signals in our bodies that are trying to give us certain messages, like whether we're doing certain activities in our lives or just kind of like telling us to slow down? Like, what do you see when it comes to that?
So yeah, it definitely is most of the time telling you to stop and listen and take care and slow down. It's mostly slow down with chronic pain. And, acute pain obviously happens, like my accident yesterday. I know exactly what the source of it was. I fell off the horse. But with chronic pain, it's usually compounded with the stress of being in pain, with the stress of perhaps not working because you're in pain, with the stress of family things. So when you're able to take a step back, lean in, listen to your body, you're able to make progress and move forward.
Yeah, for sure. Do you see that these signals, I mean, because pain can be caused from so many different reasons, right? Again, we can be doing things throughout our day. I mean, it could be emotional stress even. Like these things you're just kind of like holding on to, and muscle imbalances, like all these types of things. And getting to the root of the issue is so important. So just kind of like having that self-awareness is one of the first steps.
100%. And also, if you have reoccurrent pain that possibly comes and goes, I would encourage you to step back and take a look at what the emotional situation is. I had a client who was a runner and he had plantar fasciitis. And it so happened that he was also getting divorced when the plantar fasciitis came up. So we treated that, we worked on that, it subsided, he went on with his life. 2 years later, he's got plantar fasciitis again, and don't you know, he broke up with his girlfriend, and the plantar fasciitis reared its ugly head. And so, especially with this person, the plantar fasciitis is directly tied when he has emotional stress. So I thought that was really interesting. And then another thing that happened to me, which I thought was kind of interesting, was I have ulcerative colitis, but I also have anxiety. And for the longest time, I wasn't able to differentiate between what they felt like because they were showing up as exactly the same symptoms. So when I stopped and learned how to listen to my body, I was like, oh, okay, I can appreciate where this is coming from, how this feels, how I manage it, what I do to treat it, how do I regulate it.
Yeah. It can help us have that self-awareness in a sense. Just help us be in a state of peace, right? Because
yes,
after the session, you're a lot more relaxed. And you just kind of think through things much easier as well.
yes, that is definitely something that can happen for sure. Sometimes you get stirred up and you learn things. Something else that happened to me after more treatment was I had completely forgotten about a car accident I was in when I was 8 years old. And again, after receiving treatment and going through some somatic experiences, I remembered this accident. It wasn't particularly traumatic, but I was thrown around the car because back in the day we didn't wear seatbelts. So I actually remember flying through from the front seat to the back seat of the car. And I didn't get super badly hurt, which I don't know how that happened. But yeah, I completely had forgotten about that memory. So it is true that the body keeps the score because it remembers what the mind forgets.
Wow. Yeah. Because these things, like can get potentially buried, right? And when they kind of come to the surface and become aware of them, that's when the healing takes place as well.
That's exactly when the healing takes place. That's exactly when the healing takes place. And that's when we're able to move forward and pass things. And
Right.
yeah. And the cheesiest thing I say to my patients is, you have to feel it to heal it.
Yeah. That's
The other-
true. I mean,
Yeah. The other cheesy thing I like to say is that the issues are in your tissues.
yeah. Both
But
of those.
it's
I mean,
true. They're profound and they're true.
it is. I mean, because the body can be like a printout of what's happening in our minds as well, right? It's like, I always like to say the mind is the foundation of the decisions that we make, right? But it's also, I mean, the crazy amount of science that goes into how our thoughts impact our biology or how we feel. It's a very real thing. And, we think about wellness in so many aspects, but it's like getting the issue in terms of like how we think and, all these things that we may not think they're interconnected, but they definitely are.
Yeah. So again, before myofascial release, I would have completely dismissed what I'm about to say, but everything is energy. Literally everything is energy. We're energy, the computer's energy, but our thoughts are energy. Our emotions are energy because that's what we have available to us. And what you think really does make a difference. And processing and feeling and being really in touch with that energy is so important. And I'm not saying you have to think positive thoughts, but you have to feel the experiences you're having in your body and honor them. And that's how you make progress and move forward and connect with your mind and your body.
Yeah, we definitely have to honor it because we can just kind of like push these things to the side and just keep on going. But I just find that you're much more fulfilled version of yourself when you actually heal, right? And you kind of get to these things, and it's better expression of how we live, right? It's like, of course, we're living every single day from our paradigm and things we're used to, but like it's kind of like operating out of our full potential, and it takes work, for sure.
Yes. It takes courage, and you have to be brave to live fully, because you have to be willing to unpack what's your past. And most of us spend so much time in our head and avoiding what has happened to us. And when you begin to, again, allow yourself to feel your feelings, I mean, society does a really good job of telling us, don't feel that way. If you're angry, stuff it. You want to say something, don't say it, and because it's energy, it has to go someplace, right? Because energy isn't, you can't create it and you can't destroy it. It has to go someplace, so it gets trapped in you. Now, I'm not saying if you're mad at your boss, go like punch him in the nose. That's not what I'm saying. But if you're able to, after the interaction, you can go and, excuse yourself and have an appropriate outlet. Scream, punch the air, do something to dissipate that. That's going to help you move past and not allow things to get stuck and trapped.
Yeah, it's more so about doing it in an intelligent manner, right? Just being able to express things that we need to express, but like doing it in a way that is constructive, right? Like that is generative.
Yes.
To optimize.
Punch your pillow. If that's how you're feeling, or cry if that's how you're feeling. Don't shut your feelings down. Obviously, again, it has to be in an appropriate manner, but allow yourself to feel your feelings is again my number one takeaway.
And you mentioned it takes courage as well, right? Just being able to look at it, move through that fear, right?
Yes.
And just being able to get to the other side. And I feel like that process has forged our character to live the life that we're meant to lead. It's like these challenges are kind of meant to develop to forward us, I find. So. Yeah,
the thing that I think that changed for me was when I was getting my first couple hours of treatment. The therapist said, "What's the worst that could happen if you took off your brakes?" And for me, at that moment, that was what I needed to hear, and it gave me permission to feel the feelings and to allow my body to move the way it needed to move, and for the real healing to begin, because I had lived my whole life so shut down, so stuck, such in protective mode that I got to, you are where you are by the choices you make, and I was where I was. And just hearing what's the worst that could happen if you allow literally changed my life. It changed my career, it changed my relationships, it changed everything.
Yeah. So when it comes to different conditions that people experience, whether it's a chronic disease, illness, whatever it is, like, you find that this can actually be beneficial in terms of the healing process. I know like there's more to it than that, but I'm sure that this can be very beneficial in terms of like getting to the parasympathetic state, just being able to kind of rest. Do you see that?
Yes, 100%. People are able to finally soften and allow their bodies to heal because it gives people the space and the safety to allow for authentic healing. That's the name of the game. When the body feels safe, it begins to release and relax. And that is what I believe myofascial release is. That's why it's the greatest gift. It allows your body to feel safe because it's a very gentle, very slow modality. It's not abrupt and it doesn't force anything.
Right, because we can do all these amazing techniques in terms of nutrition, sleep, exercise, but if we're just in this chronically stressed state, like it's not really going to work the same. So we need to be in a receptive state to actually utilize these things.
100%. Yeah, you don't actually probably need to drink more water. You just need to allow yourself to get more hydrated by reducing your restrictions. That's probably, save your money. You're probably already eating correctly and taking the correct nutrition. Just allow your body to absorb it and utilize it more efficiently and more effectively.
That's right, because so many people work so hard to get to this level of health, and sometimes it's like the blind spots they're not aware of, right? These things that, if we just kind of work with synergy, like what is that missing thing, right? And it's available. We just gotta make that forward progress and ask empowering questions to get to the issue too.
Yeah, 100%. I like to say that, most of my clients will come to me because I'm the last stop before either surgery or, pain pills forever. And I would love to get the word out there that myofascial release is a therapy that is available to you immediately. Don't wait until PT hasn't worked. The chiropractor hasn't been as successful as you'd hoped. Acupuncture didn't provide the full relief. Know that this is a treatment and a therapy that is available to you. And, come see us sooner. We would love to be part of your healthcare team.
100%. So while you're talking, I'm like, is there a difference between massage and myofascial release? I'm sure there's synergy between that, but is there myofascial release a broad term in a sense, and there's kind of these different types? How does that work?
So so myofascial release actually is like a generic term that people that offer massage therapy can use, and they may be incorporating some techniques, I'm not sure. But what I practice is the John Barnes method of myofascial release. It's very specific. So the main difference between myofascial release, the John Barnes method, and a massage is that we don't use oil and we don't use lotion. We don't glide around. Massage is great, especially if you want to relax and feel good and sort of, just go away with the fairies for an hour. There's really nothing better. But it's very relaxing, but it's not a deep therapy. It's not a treatment. It's not addressing the root cause because it doesn't have the time and the pressure element. That's really the main difference. We don't use lotion. We don't use oil. We sink into the tissues and stay there until they begin to release.
Got it. Yeah, because we kind of keep on doing these things in a sense, right? But sometimes it's temporary relief, but it's not until we get to the issue, whatever it is, right? And just being able to pinpoint that. So of course we can keep utilizing these, but it's what is it that is causing it in the first place? And we kind of go back to that, but it's really important to kind of understand wherever the pain is coming from.
Yeah, exactly. Again, that's why we are trained to treat the symptom, but we're going to look elsewhere for the cause. Because we do want your back to feel better 100%, but if it's coming from your hip and you're only addressing the back, you're never, ever going to get to the bottom of it. So that is why I'm so passionate about myofascial release. And I've seen so many of my own clients, and then I know many other therapists that have also had so much success with their own clients, and personally, my experience with it. You know, even if I didn't do this work, I would still love it because it has been so life-changing. And even just yesterday, like falling off my horse and being able to get out of pain and doing so much better today than normally I would if I hadn't gotten the work yesterday.
Yeah. Glad to hear that. I mean, it's like, there's a lot of people, we have like back pain as well. It's such a common thing. And a lot of times it's from different areas, like just being able to kind of, because when if we work holistically with the body, where we actually work on everything, like making sure that everything is mobile, you're just going to be injury proof in so many ways, because it's like the tightness in certain areas aren't going to affect other areas, right? So it's very important to kind of like bolster a whole level of mobility.
Exactly. Bolster a whole level of mobility, because you also have compensatory patterns if you're holding a hip, if you're holding a shoulder. So that's also causing a lack of flexibility and lack of mobility in other parts of your body, and you're not getting the full range of motion because of the compensatory patterns. And it depends on what your issue is. But yeah, this releases a lot of things. It just improves your life.
I'm glad you mentioned that, because compensation, it's a thing for real. It's like we have these issues, and then our body like does its best to get itself organized, right? But we have to do that in an unfortunate way, right? And we just go around like that for years or decades, and then we wonder why we have these, like, you know, surgeries need to take place and all these things. It's because we're not, you know, living in an optimal way. But again, we're not even aware.
Exactly. You would be surprised how many clients come in and we stand in front of a mirror and I point out, did you realize that, you know, your pelvis is shifted like a good half inch underneath you to the left? You're not even standing fully on top of yourself. You have a shift. Your upper body is not lined up with your lower body. Or look at the discrepancy between how much higher your one shoulder is than your other shoulder. People go through this, they don't realize it. And it's, you know, again, awareness is key, because awareness offers choice.
100%, yeah. And it's like being aware of our posture as well. It's like being cognizant of how we are mobile throughout the day is very important. And this can dramatically affect our posture, just being able to release anything that is chronically tight, or, you know, just release all these adhesions. It can actually improve, like, not our overall function, but, you know, how we're actually like aligned as well.
Yes, 100%. I'm not going to say this cures scoliosis, not even a little bit, but I have seen other practitioners that have remarkable results with posture, spine, you know, straightening. Lordosis is improved. It's just amazing when you put room in the fascial system, the bones are able on their own to go back to where they want to go.
Wow. Yeah, I mean, because it's how these things are connected. It's being able to be in proper alignment is going to lead to much more fluid motion as well. Just being able to move gracefully, in a sense.
Yeah, it's much easier when all of your parts are fluid. I mean, it's supposed to be a fluid, dynamic system. And again, because we're from the top of our head to the bottom of our feet, if everything is moving fluidly, everything is just easier. Everything is more natural. Everything is more balanced.
100%. That's what it's all about. All right, Gwen, this has been awesome. Appreciate you sharing your story with us, your message, and just being aware of what fascia is, right? It's just interconnected tissue that runs throughout our whole bodies. And just being able to manage that in a healthy way can really transform our health and wellness. So just being able to learn all the tools of myofascial release and how we get interconnected, right? Because again, we talked about how it's related to our emotional system, and being able to get to the root of the issue is a big key to that. And this is very important. So again, I thank you for coming on the show, and it's been an honor.
Thank you so much for having me. I have enjoyed this immensely. I love talking about fascia, and I love sharing about how it's going to help people get out of pain.
Awesome. So if people want to get connected with you and your work, where can we find you?
So I'm located in the greater Los Angeles area. Please visit my website at performancemfr.com, or you can give me a call, 415-505-7337. And I'm on social, which is Performance Myofascial Release. So again, thank you, and I would love to work with anyone who's in the greater LA area, or please check out the directory and find yourself a local therapist. You deserve to feel great.
Awesome. Thank you.